Hello, this is Constance Stokes, and this is my e-portfolio that I've created to study for the NBCOT and utilize during my Level 2 fieldwork experiences. This foundational review is comprised of several concept maps, which are strategically organized to optimize my review about what we have learned throughout our entire OT curriculum. And also, as I continue to learn in my Fieldwork 2 rotations, I also plan to expand this e-portfolio with new information to better prepare me for the NBCOT and my future career as an OT. So first at the bottom here, as you can see, I have created label headings, which indicate what major topic will be covered on that tab. So this will help me quickly and easily reference any particular information that I need to look at. So first I started with the OTPF. I wanted to go over this first because it really provides a foundation for occupational therapy practice. It really provides a common understanding of the profession and its values, as well as acts as a guide for our practice. So knowing this first will really help us better understand occupational therapy in general, and it will help us build upon with these following topics that we'll discuss. So you can see my map here. Here we have some of the domains of occupational therapy, which shows what our scope of practice is. So I've color-coded each one of these domains to keep them better organized and for easier recognition of what is included under each one. I really like the simplicity of this map and its conciseness of the information. And then we keep going, and we have the OT process here, which covers the evaluation, intervention, and targeted outcomes. And then this is further broken down into what is addressed in each step, like these, as you can see. And this will be a great resource to implement in our fieldwork rotations and refer to for the NBCOT. Next, I have the OT models and frames of reference. This covers information between different textbooks, so this is a really good comprehensive list that we can utilize and will be beneficial to review for both fieldwork and the NBCOT. Having a general knowledge of this is really important in planning and guiding our interventions. Each one has its own box, as you can see, and it includes key concepts, how it is documented, and then at the bottom there are also some YouTube links that I can reference if I ever need more in-depth information. And this is really a great way to mix up learning methods by providing an auditory option to listen to the material. Again, I appreciate the simplicity and straightforwardness of this whole concept map, and how it covers so much information in a concise and easy to read way. So after having this foundational knowledge that we learned in OT school, I organized the rest of the tabs based on the timeline from graduation to preparing for our certification and sitting for the exam, which we will cover on this page, to then working as an OT and seeing patients in a clinical setting. So I like how this concept map is split into two sides. One over here that where we're covering the exam procedures, content and format, and then the credential agencies. And then on the other side, we have the process of actually sitting for the exam, how to prepare for it, and really what to expect. Having this will really help me to stay organized in what I have to prepare for and complete prior to the exam, and then what the actual expectations are during the exam. So this will be key to review prior to taking the NBCOT, as well as reflecting on my OTKE practice test, to help me really relieve any nerves that I may have about the exam. And it'll also give me good insight into how to mentally and physically prepare myself to take the NBCOT. Next, we'll dive into goal writing, which is how we'll measure our progress and changes in therapy. So this concept map is a little bit more colorful, but I like that it breaks down all of the aspects of goal writing into these 4 different sections and really goes over what we need to consider and be aware of when we document. So we have this section right here. We also have the different types of goal directions, which are all client-centered and reflect what our ultimate aim is for therapy. So each one has a description of what it is, as well as examples for each one, for a better understanding of how to write these type of goals. Over here we have the formats for goal writing, and this will really vary amongst the different settings, but it really breaks down and organizes what is included in each goal format and what each part means. I really like that these 2 sections are in table format because it's very easy to read and it's organized in a way for quick referencing. And then we have up here, we have some goal specifics. We just want to make sure that our goals are clear, concise, and appropriate, and that anyone who reads our goals knows exactly what we'll be doing in therapy. So this will really be essential to review and prepare for Fieldwork 2 as we begin taking on caseloads and writing goals for our clients. Now we are going to go over utilizing occupationist therapy as well as teaching and learning. I like how this page was condensed and included these 3 topics together because I feel that they are very interrelated. And really brings together the interactions of the client as a learner, the therapist as a teacher, and then the occupations themselves. So each section is separated and broken down into their respective parts. There are some great tables of the different procedures from our textbooks that have been included. And as therapists, we really want to make sure that we are meeting our clients where they're at functionally and always implement the just right challenge so that they can achieve success. And then the second part is learning. Understanding how our clients learn can really help us target intervention and utilize best practices for optimal outcomes. And it's also really important that we as therapists continue to be lifelong learners so that we can effectively teach others and provide the best quality care. Knowing how we learn is also incredibly important, and this will help us to effectively prepare and study for the NBCOT. And lastly, we have teaching as occupational therapists. We have some different teaching strategies on the left, and on the right we have therapeutic use of self, which will really help us to build rapport and connect with our clients. Overall, I feel like this is really another foundational thing for us to have in our minds as we interact with and treat our clients. Now we will dive into more of the specific topic areas, which have consolidated Radomski and Pedretti chapters for a more comprehensive and organized overview. As occupational therapists, we really need to take a holistic approach to our care, so it's important that we evaluate and treat each one of these areas if needed. So the first one I started with was cognition, and I started with this one because it really goes hand in hand with what we just went over with learning and teaching. It's a critical component of how a client acquires knowledge and understanding of what they're experiencing. So this section and the previous section was actually the sign-up topic that my team group chose. And I also integrated layouts that I liked from other sections, concept maps, into my ePortfolio as well. So this is arranged in a table format, as you can see, and it's color-coded based on the chapter. And then within each chapter, there are individual concept maps based on the subtopics. So this concept map will be a great way to break down this big chunk of information into smaller pieces, which will make it really easy to review and help with understanding and treating our patients with these conditions. So if I'm looking for anything specific, this organization will really help me to pinpoint any information I need to find. Next is the vision concept map, and I did this one next because it was a good bridge between cognition and sensation and perception, which will be on the next tab. All of the visual information is consolidated onto this map for easy reference and is again separated by chapter. I really appreciate that this concept map has tables from our textbook, like this one right here. It also has diagrams of hierarchical examples, which will really help me with studying and make it an easy way to remember these kind of things. There are also many pictures that are included, like this one, and there's a couple down here, and it really shows us how these different impairments are affecting certain parts of an individual's vision, and it gives us a better understanding of the patients and how to create more effective treatment plans that target these specific deficits. And overall, it's a great resource for any questions pertaining to this topic on the NBCOT, as well as keeping in mind for our fieldwork. After vision, we have sensation and perception. This really plays a big role in receiving input and interpreting our world. I felt that this was the best location for this topic because it closely relates to vision, which was on the previous tab, and it's also a good section to review prior to the motor planning and performance because, as we know, in real-life situations, sensation typically precedes any motor skills and abilities. And it's really necessary for any functional movement. So this concept map went back to the simplistic style since there's a lot more information here that it covers. But it's separated by chapter again. And then it's further broken down into colored headings, which is these hot pink colors. And then within that, there are the subheadings, which is this more neutral pink. And this will really give me an idea of what information will be presented within that section. And again, we have some more textbook resources and images just for better understanding of these sensory systems. And this will really be a great review for me prior to my fieldwork too, especially being in a skilled nursing facility where a lot of the clients have these kind of conditions. And this will really help me organize this chunk of information to study for the NBCOT as well. Now we have motor planning and performance. This is another straightforward and simple map that is broken down into the chapters. There are really great resource pages linked throughout here, as you can see, with more detailed information about maybe definitions, procedures, and any approaches that we could use for this. They also have some tables of the psychometric properties of some of the assessments, which is going to be very critical to know how to find these, because we really need to use our professional reasoning to make clinical decisions and pick the most appropriate assessments when we are evaluating clients. And as we go further down, we can see there's more resources of tables throughout this. It really is cleanly organized and helps us to find the information that we want to find. So on this side, these are more of the areas that are impacted and what interventions we can use to treat our patients with any motor planning deficits. And then to continue onto this side, we have some treatment approaches and techniques. In this section, I really like that it provides a general overview, and then you can actually click into each section and it provides more in-depth information that pops up. And as you can see, there's some more pictures here. So I really like that it's very clean. You can get more in-depth information. And it's really a great resource for my fieldwork too and skilled nursing again, because it really just helps me walk through that OT process for clients experiencing deficits in the motor planning and performance areas. The last tab covers musculoskeletal abilities and capacities. I like that this concept map is separated into two distinguishable sections based on the chapter. On the left, we start with the different assessments, and these are really core assessments that we can use for this population. It's really organized well into a table format, and each part of the topic can be easily located. It really breaks down the critical components of each assessment, so such as grading of the manual muscle testing, any precautions for endurance. We know safety is our #1 priority, so it's very important. How to measure edema and any precautions, and then positioning and end feels, and how to record measurements for range of motion. So all of this is very important and essential to us. And there's also some fantastic images in here as well. That really show the appropriate methods for measurement, and is really a great refresher of the basic knowledge we learned our first semester. And then over here on this side, we have some information of musculoskeletal mechanisms, as well as the biomechanical approach that really encompasses these types of assessments and treatments. So this page in particular will really be a great resource for me. Prior to my fieldwork too in skilled nursing, as these are really common assessments, and my site actually encouraged me to review this specific part prior to starting fieldwork. So overall, this will really help me to reflect back on what we have learned over our entire OT curriculum. It really gives me a comprehensive resource to study for the NBCOT, and it can improve my competence in OT in both my fieldwork and career. Thanks for watching.